guest today.
Yes.
Who is our guest?
Dr. Scott Eisenberg. He's a cardiologist, and we want to welcome you here at our show and ask you some questions, and you give us all the information you can about what's going on.
Well, thanks for having me.
Oh, it's a pleasure. I love doctors anyway. I see so many of them. But a lot of people know what heart disease, that heart disease occurs with aging and weight issues. Are there specialists that can really help us make adjustments to reduce our risks?
As a matter of fact, there are. There's a growing trend of anti-aging specialists, and there's a growing trend of something called lipidology, of which at this point in time in the state of New Jersey, at least, I'm probably the only person that has triple certification in all of these. It's cardiology, lipidology, which is more the study of cholesterol, how we form it, as well as prevention, and anti-aging with applications towards taking our vessels and making them younger. Anti-aging takes on a lot of characteristics, but in the heart world or in the vascular world, we can do a lot of natural things in addition to, of course, diet and exercise to be able to improve the vessels in our brain, in our heart, and in our legs, so that there's a lot of characteristics that are now taking shape. More people are becoming educated in the fact that medicines, with all the side effects and with all the cost issues, are not necessarily the best ways to go. That being said, we get sick, we need to take certain medications. So one foot needs to be firmly planted in traditional medicine, but then more and more people are saying, what can you do more for me that's not going to hurt me, and also not going to take my bank account and drop it down to zero.
Well, to me that's very important because I happen to have high cholesterol and I can't be on these statins.
Exactly.
So they do a number on me. So I'm so glad to hear that there are natural remedies.
Well, there are, but there's also remedies that actually we can take along with statins. A lot of people are misinformed about how dangerous statins are. They're also misinformed that because they take one and maybe one or two hurt them, that none of them are possible to be taken. So that we can take certain nutrients that are over the counter that actually may counteract some of the muscle aches and other things that we get. And so that sometimes it's not just the simple things. You may have heard of coenzyme Q10, but now there are 3 or 4 things that we can take, that we can offer our patients at the same time if they must or must take a statin to reduce heart disease after they've already gotten a blockage somewhere in their body. So that there are now more natural applications for that. And we can do what I would call an end around. We can go around the statin controversy and use other natural ingredients along with other medications to get the same results, which is, of course, prevention. I take, Dr. Scott's philosophies are, number 1, get to it before it gets to you, and number 2, bad patients and bad doctors wait, but good ones prevent. So that's our number 1 philosophy. I
love that philosophy. No.
And you mentioned the misconceptions about statins. What are some other misconceptions about heart disease?
Well, terrific. I kind of formulated something we call the SmarterHeartU University.
Okay.
And there are 5 major things that are available from our office that people can call up for. But in a nutshell, the first one is, of course, about symptoms. I always say if you're waiting for an elephant to come sit on your chest, keep waiting. And most of the time, that only occurs about 25% of the time. And especially in women, generally speaking, things like getting dizzy or tired or nauseous or sick to the stomach, they may be more of the signs of an impending heart problem than anything else, like the typical pressure on the chest. The second thing is we're always taking EKGs, the electrocardiograms. Most of the time, those are normal unless someone's actually having a heart attack or they've had heart damage. The third thing is cholesterol, as you mentioned. Most of the time, the numbers, the total cholesterol really, unless it's very, very high, usually will not predict your mortality. Likewise, your bad cholesterol, 70% of the time is not significantly elevated, and yet it's quality. I tell patients, We have sand and mud, and we have mud. We like sand. We don't like mud. The quality of the cholesterol a lot of times is much more damaging than the levels of cholesterol. So the majority of people that are going to have a heart attack or a blockage or a bypass or even carotids or strokes or mini strokes, a lot of times their cholesterol is not high and doesn't need to be taking all of these medications. There are other things that we can do and other blood tests. There are advanced blood tests that have been available for all doctors to check for the past 5 years. Wow. The next thing would be stress tests. Stress tests have a 20 to 30% margin of error. Stress tests, other studies, I often tell my patients, you're dependent on the quality of the machine that's being done on, the quality of the technician performing it, and the quality of the doctor reading it. Right. Even at the best, sometimes we can miss 20%, maybe even up to 30%. And we have to kind of put on our thinking caps and make decisions on how our patient presents in terms of their symptoms, as well as all the other risk factors, and put it together in terms of what we make our recommendations at that point. Another major thing is that because of the stress tests and different things, that we have to do angiograms. We have to be invasive. In fact, for anybody 65 and older, there's a 15-second CAT scan of their arteries that's performed, pretty much covered by Medicare, 100%, and is covered, and in most of those people are candidates without any problems, that can be done to kind of separate those abnormalities instead of kind of steamrolling into invasive procedures. I'm a plumber by trade, but I took a long time ago the approach that I'd like to prevent the clog from forming or prevent it from coming back. And that's what anti-aging is about. That's what lipidology is about. Prevention.
Well, what are some of the things you do to prevent it?
Well, and when we look at the diet, when we look at exercise, we realize that our patients are going to be set in their ways. So that we try to give them more of a structure and say, these are the kind of food groups. And again, people can call up our office. They don't have to make an appointment. We'd be happy to send them a packet with the foods that we would recommend following what we would call the Mediterranean lifestyle, which is the best lifestyle to approach. And again, they can kind of get some of the myths that are out there based on TV that we see and what we read in the newspapers that causes all of this fear. It's really a lot more simple than that. So that if you're not sure, you have to you really should see someone to evaluate what your risk is. You shouldn't just say the famous last words are not. This will go away. The famous last words are, but I feel fine. Right. And that's where we all take an approach. So we try to intervene before that. And really, it's an individual basis because everyone is like a snowflake. There's no one alike. So when you say what types of things that we can do, we don't know until that person comes in and we kind of stratify them, put them in their proper risk. Are they low? Are they medium? Or are they high?
Well, isn't it your internist that has to recommend an office like yours?
Well, not always.
You mean you can go on your own?
Absolutely. Absolutely. If you have a risk, you can find a heart doctor. A lot of times there are wonderful primary doctors that are out there that are now getting into this. This is not just a specialist field. There's plenty of doctors that are now getting into anti-aging. They're internists and primary medical doctors. And there are even some now board-certified lipid specialists that are primary doctors and ones that I train with that are now interested in this field. It's a growing field. There's 40,000 physicians across the United States that are involved in anti-aging, and there's about 3,000 or 4,000 that are doing the lipidology right now.
So we're living longer, so you have a good field to work with.
Well, it's funny that you should say that because that was number 5 misconception, is that after 65 or 75, it's age that takes over in terms of developing vascular problems in the brain and in the heart and in the legs. That's actually not true. Many times someone will come to me at 50 or 60 and I'll say, well, do you have a family history? And they'll say, well, my mom and my dad had bypass at 80 years old. And I'll say, you have a family history. Did they look 80? No. Did they act 80? No. so we don't treat them like they're 80.
Mm-hmm.
And that's another misconception, is we shouldn't treat you like your birth date. We should treat you like your quality of life.
Mm-hmm.
And that's where today's physician needs to be placed, and today's patient needs. You know, there's a great philosopher, Cy Sims, perhaps you know him. He said an educated consumer is the best customer.
Mm-hmm.
Yeah.
And that is the best thing to do.
I know Cy Sims.
He was a great philosopher. I go by that mentality, and I think today's patient needs to be much more educated, that they have options.
Sure. And be active in their treatment.
They
as well.
absolutely need to be educated and
Have to be
active in their
involved,
treatment.
too.
Exactly.